As you're aware, there's a lot of discussion around healthcare reform. Your employer has been reviewing the best options for you, and the purpose of this video is to discuss changes to your benefits, give you guidance on completing your application, and provide you with a list of helpful tips. Here are some of the major differences between your old and new plan. Under the healthcare reform law, carriers can no longer put a waiting period on a pre-existing condition for individuals on a PPO plan. It should be noted that this never applied to those on an HMO plan. Your plan now includes no-cost preventative care. This includes physical exams, well baby care, and well woman care. All deductibles, co-pays, and prescription drugs now count towards your out-of-pocket maximum. There is no longer an upper-level cap to the amount of benefits you can receive under a plan. A pediatric dental and vision benefit is now included for children up to age 19. You are now able to keep your dependent children on your plan until they turn age 26. These children do not need to be listed as dependents on their parents' income taxes. They no longer need to be full-time students. They can be married, not living at home, and still remain on their parents' plan. Before we move on to the enrollment form, we need to talk about Covered California, the state exchange. In California, individuals who earn between 138% and 400% of the federal poverty level may be eligible to receive financial assistance by enrolling in an individual plan in Covered California, but only if they are not offered coverage through an employer. Because you are being offered coverage through your employer, you are not eligible to receive a subsidy. If the IRS discovers you are receiving a subsidy and that you have been offered coverage through your employer, you will be required to pay the money back to the IRS. If you have any questions, contact your HR manager or broker for advice. Now, let's take a closer look at the enrollment form. The enrollment form is easy to complete, but oftentimes, important items are overlooked. If you are enrolling, you will need to provide the following information for yourself, your spouse, and your children: Social Security number, date of birth, and home address. In addition, please make sure you indicate your marital status, employment status, hire date, number of hours worked, plan selection, the name and ID number of your primary care physician if you are enrolling in an HMO plan. The insurance carrier will need to know who is enrolling and who is not enrolling in a plan, and you'll need to mark the form accordingly. For example, if you are declining coverage because you are covered by your spouse or enrolled in other insurance, you will need to indicate the reason why, sign on the line that states you are declining coverage, and provide a copy of your medical ID card with your application. If you are married and/or have children and want to include them on the plan, you'll need to list them on the application and provide all pertinent information such as Social Security number, dates of birth, and home zip codes. If you are married and do not want to add your spouse or children to the plan, you would not list them, but you will need to sign on the line that states you are declining coverage. You do not need to provide a medical ID card for dependents. Also, do not forget to sign the application even if you are declining coverage for yourself and/or your dependents. Lastly, here are some helpful tips. Refill your prescription medication under the old plan prior to the end of the month to ensure you don't run out. If you have a pending procedure, let your employer or HR manager know so they can properly advise the insurance broker. ID cards typically take between 7 to 10 business days after the insurance company approves the application. If you need medical services and haven't received your ID card, talk to your HR manager. You may also be able to go online and print a temporary card. After you have been enrolled in your new plan, register and log in to the carrier's website where you'll find useful information like provider directories, prescription formularies, your benefits, wellness tools, and more. If you have further questions, your HR manager or employer can contact your broker to assist you.